let me introduce with the idea of using, COVID as a heuristic, trying to come up with a response for this, and that is when we need to understand that what companies need to do is to react. Okay, companies need to react. They need to understand how this thing affects them in their particular context and come up with this response. Okay, so we're going to take the notion, the construct, the idea of reaction. Okay, reaction. So reaction is your choice. Okay, we cannot remain muted or inactive or passive, or you cannot give up, or you cannot defeat yourself, or you have to somehow react to this. Okay, and that's what we want to say. So understanding reaction. Okay, let us start with the notion of coronavirus. What is this thing? The novel, they call them the novel coronavirus 19, whatever, and COVID, and so many technical names that come after that. Here, there's a link, okay? There's a link. This link is actually in Spanish. I couldn't find anything in English. No, I'm sorry. This is National Geographic in English. I'm sorry. One of them is in Spanish. I don't remember which one is that. But this one talks about 7 types of basic coronavirus. 7. This is dated October 9th, 2020. Okay. How many new versions do we have of coronavirus? The English version, the South American version, the Brazilian version, the whatever, maybe Mexican. Okay. And even more so, fascinating in terms of reaction is understanding one of the basic, central ideas that we learn in globalization in business, okay, which is this convention of the definition of this term that many of you probably have already heard about, which is glocal. Okay, glocal as the combination of global and local, as in global and local. The two together come up with glocal. And this is an Investopedia, entry, this website on business terms on the definition of what is glocal. But I'm going to assume that you and I have a fair understanding. So what is COVID? COVID is a pandemic with local effects. It's global with local impacts. And those local impacts are different from one context into another. So this is a perfect case of localization. Localization strategies of what? Of Google, of Coca-Cola, of Nike. I mean, local is the way in which we inherently operate in marketing. So this is a very good way for us to understand that. This is a pandemic with local manifestations. So there's this common ground about it, but there's the need to adapt locally to whatever specific circumstances posed by this pandemic, okay? It's a perfect case of localization. So what is going to happen? Well, yeah, irrespective of anything, the GDP and many other, economic measures are indicating that we're going to have to restart the economy at some point because, I believe that depending on the way you measure it, I'm trying to remember what is the impact in Canada was about 8% of the GDP. And obviously, taking back, the Canadian economy grows about 2.53% every year. So, 8 points is like 2 to 3 years in which we're going to have to catch up, okay? So going back to normal or where we were in 2025 is not, that crazy. We're going to have to develop infrastructure. We're going to have to develop public policies just to understand how to do that. That is at the macro level, okay? New economy factors, infrastructure for the new normal, whatever that is, at least for the next 3 years, and public policy that has to do with the way in which governments spend resources and energy and attention into this issue, okay? It's a huge distraction, let me put it this way, okay? From what? From the typical problems, education, sustainability, fairness, social justice, whatever. So all that stuff that is already there, it's probably suffering because much of the attention of the government is now placed into this extraneous factor. And the interesting thing about this reaction is that we also can use it to see perspectives or dimensions of COVID. There's no such thing as one single COVID. I mean, not even when you talk about the virus itself, it's the perspectives. So there's a COVID for health. There's a COVID impact on work. There's a COVID impact in socialization. You tell me, you name it. I mean, I'm actually talking with people who are just working with the mental health of students because of this situation. Okay, and this is an expert from the University of British Columbia who is telling me, Salvador, no, it's not just college, it's like elementary school. Kids in kindergarten are struggling because of the lack of socialization. Mm, how many platforms, how many crazy stuff have we professors implemented over the last 11 months? We, my dear students, we're tired. We're as tired as you are. We're fed up. We're sick of all these managers telling us what to do. We are very frustrated because we try to do our best getting our students' attention, and everybody's just fed up of so many conferences, like video conferences like this. I got you here captive because of your wonderful Professor Weiss. So I had better do my best job trying to make a point here. Otherwise, some of you are just going to quit. Okay. So and the point that I'm trying to make is quite a challenge. Okay. Especially for some people like that. Again, I've been teaching online and using this environment, this type of a learning environment since the 1990s. Okay. So I'm seasoned into that. I know how to engage audiences online. But I'm not the typical professor. I don't mean to be arrogant, but Tech de Monterrey gave us a lot of training in this kind of stuff years ago. So I'm reaping the benefits of that training. There's the COVID economy and the COVID for politics. So how many did I tell you? 6 dimensions, 6 perspectives. Okay. So COVID and Canada. COVID and Canada is a very interesting thing. Canada is a country of the first world for many reasons. One of them is for the access, quick access to reliable information, which is amazing. These guys keep a track of pretty much everything, every single case in every region. Over the last, say, this is 4 months. Although you can go and check before that, because you can go and check here and see, as you can see in this factor all the time. Let's just stick with this because it sort of gives a closer lens of what is the situation. Every single day, the number of cases. But you want to know what happened? I mean, new cases, active cases, deaths, and hospitalizations. The vaccination strategy rolling out. Doses distributed per, in the country per province too, as per province too, each and every one of them, as of today. Okay. The Pfizer, BioNTech, and Moderna vaccines have been approved for use in Canada. Require 2 doses for someone to be fully vaccinated. We had a very interesting situation because our Prime Minister, Trudeau, was the bearer of the bad news that essentially the amount of vaccinations committed to Canada, essentially from these 2 companies, was essentially not fulfilled. Okay, so about 6 months ago, we knew that Canada was getting like 40 million doses. Okay, there's 35 million Canadians, so that would have been enough for each and every one of us to get at least 1 doses, or to get as they call enough. Let me put it this way: society immunity. And then with that, having 60-70% of society with immunity to the disease, then we're out. We're like New Zealand or Israel or one of those, and we have that advantage of having only 35 million people in the population, maybe 40, but no more than that. So there was enough vaccinations, but they did not deliver. So now what the Canadian society is doing is obviously they're recriminating the government, like in other country. How come you guys actually move all the manufacturing facilities abroad? I mean, because it was so much cheaper for you to manufacture in China. So all the Canadian pharmaceutical companies ended up doing the same thing, and now they're paying the price. Okay, and now this is a very severe criticism for the same situation in the United States. I mean, the lack of manufacturing facilities is creating a problem. But this country is also extremely resourceful, and we don't have the facilities to do, but we do have state-of-the-art research centers. So we're not only creating our own vaccination, our own vaccine, we're also creating the rapid testing, Canadian-made, and we have one of the most important research centers in the whole world. Actually, the Canadian, Center for Disease Control and Prevention is strictly connected to the one in the United States. It's one of the most reputed in the world, and SARS and other diseases we're actually working at. Works with another 8 countries like Germany and England and Australia creating state-of-the-art vaccination technology. So we do have the technology. In normal circumstances, what people do here is they do the science and then they take it away for countries with other types of manufacturing facilities. Anyway, lots of information, lots of information. If you know Canada, if you're basically familiar, we don't have states, we have provinces, okay? Canada, it's a constitutional monarchy. We essentially have the Queen of Elizabeth as the head of state, and then we have a head of the country or a president, which is not a president; it's a prime minister. And the thing is, these are the provinces which are fiercely independent. Okay, it's more than what you would see in that. So even with that, and with all these relative independence, you have to remember that this is also a bilingual country with Quebec, whatever. It's essentially like 30% of the population, and about 40% of the no 30 yeah it's 40% of the population is bilingual or French speaking. Okay, so and they are like 30% of the population. So about 10% extra Canadians are bilingual. Many of us in the West don't see much of it. Je peux dire quelque chose en français, but I learned that in France, not here. And maybe you need to move there to see. But again, it's another idiosyncrasy of the country. Cases and deaths, just to name a few. Okay, a bunch of information, very interesting. Also for you to see all these pages when you have an opportunity to go on your own and check that thing out. Maybe COVID in Canada. We do have information, and if you do have information, you have the means to start correcting the problem. Okay, so reaction. What I said as a would-be marketing strategy. Let us just define it. Okay, there's this funny series of definition. This is a Google search of the word reaction, and what it says is an action performed or a feeling experienced in response to a situation or event. This is just perfect for COVID. Okay, so an action performed or a feeling experienced in response to COVID. Okay, and that's the example. A person's ability to respond physically and mentally to external stimuli. That's another interesting perspective of this definition. So, person's ability to respond physically and mentally to challenges posed by the environment. So that's an interesting. The third connotation of the word, it's even more interesting. For it says in adverse psychological an adverse psychological response to a substance that has been breathed in, ingested, or touched. In this case, the droplets of saliva that contain that stuff, and hence the use of masks and sanitation and all that stuff. So yeah, reaction, it's just perfect for COVID in all this way. So 1, 2, 3 angles for the word perfectly match the situation that we happen to be living. Excuse me, I'm drinking my tea here. So reaction-based marketing theory of go-to-market. Okay, what am I going to do? I'm a professor. I told you about these things. I'm going to just borrow from recent, let me put it this way, trends in marketing. This is not exactly new stuff. Lawrence Friedman, by the way, this is a link to his book, okay, to his book. Friedman is an English professor who was kind of controversial because he said, I'm going to come up with a new, approach to marketing. I'm going to call it go-to-market. And go-to-market is what? Well, I'm just going to probably, if you want to read the book, which is interesting, again, it was hot reading some 8 years ago. What he says is you need to focus, shorten, and accelerate your marketing strategy.